ILD stands for Interstitial Lung Disease. So it is a group of almost 100 to 200 diseases. Yes, so these all diseases, they present in a similar way, but they are caused by very different type of antigens or instigating stimulus, and they all lead to inflammation and scarring of the interstitium of the lung. So if you may ask me, what is interstitium of the lungs? So lungs are formed by our windpipe, the bronchus, and the ending areas that are the alveoli. The alveoli are attached to each other by a system of connective tissue that is called as the interstitium. God has kept the interstitium very thin because, when there is an alveoli that is filled with air, and there is interstitium, and then after the interstitium there is blood vessels, so the oxygen needs to travel from the alveoli to the blood vessel. So the interstitium needs to be very thin so that the oxygen can easily travel. But in ILD, the interstitium, that is the space between the blood vessel and the alveoli, that becomes thickened. Yes, there is scarring happening there. There is inflammation happening there. So due to many reasons, it becomes thickened. So the space between the blood vessel and the alveoli, that increases. So even if the oxygen in alveolus is good enough, but it fails to cross the barrier and reach the blood vessel, so these patients always suffer from desaturation. That is, the oxygen drops down, the saturation falls in these patients. So that is the mechanism that is happening in interstitial lung diseases. It is characterized by inflammation. It is characterized by scarring of the lung tissue. And all in all, that is what the picture of ILD is. So one of the major roles that play in hypersensitivity pneumonitis is played by the pigeon droppings and feathers. So due to industrialization, due to urbanization, there are lots of flats and big buildings that are being constructed, and due to which the main bird in our society has become the pigeons. Their feathers and droppings, they have been studied and known to cause this deadly disease, that is the hypersensitivity pneumonitis. Then another disease, another cause that is being found is the stone crushers. The people who are working in the stone crushing industry or factory, they tend to get this disease, ILD. Then another cause that has been found out is those in farmers where they put their cultivation in a room, and where a lot of fungus or another kind of acetonomycetes or some kind of mold that grows onto that cultivation, and when the farmer visits again that room, then he gets this disease. Then there is another type of hypersensitivity pneumonitis that we found out in our study, that there were electricians who got HP, that is the short form of hypersensitivity pneumonitis. When they got down into a well, yes, they went inside to correct something of some electrical point that was being repaired there, and when they came out of that well, then due to the high exposure of molds and fungal spores inside the well, they got this disease of HP. Then apart from HP, ILD can also be caused by connective tissue disorders. That is when we call it as CTD ILD. The people who are suffering from rheumatoid arthritis, Sjogren's syndrome, systemic sclerosis, then these people also have a good tendency to develop ILD in the later years of their life. So there are many causes of this disease, ILD, and they all these causes, they cause interstitium to get thickened. The patients generally suffer from breathlessness on exertion, and this breathlessness also progresses with time. As well as these patients also suffer from dry hacking cough, and that cough is so severe, and it does not get relieved with any normal measure, or even cough syrup and every other medicine fail to relieve that hacking cough. Apart from that, these patients also suffer from multi-system disorder diseases, like various systems. What we generally ask these patients, do they have any mouth ulcers, skin ulcers? Then do they have any thickening of the skin? Or is there any, GERD symptom, that is any gastroesophageal reflux, or there is any burning in the chest that these people suffer from? Or do they have any joint pains? So all these multitude or wide array of symptoms, they form a complex, and they are all like one or few of the composition of the ILD symptoms. Interstitial lung disease, by the virtue of its name, it gradually progresses in with time, and the complications are many. The patients suffer from mental complications like depression, anxiety, because they need oxygen for like small daily routine work. Like if they want to take a bath, then that is a struggle for them. If they want to cook a meal for themselves, that is a struggle. So life in itself of ILD patients in the long run is very gloomy per se. So definitely these symptoms are associated with cognitive problems and CNS problems, as well as gastrointestinal problems are definitely there. Then these patients usually tend to require oxygen in the long run, so they need to like purchase oxygen concentrators for their home. And whenever they have to do some chores, so if they use that oxygen while doing any work, any routine work. And after some time, in the long run, that oxygen may be required for like sedentary purposes also, while they are sitting down, while they are lying down. That may also be like an indispensable part of their daily routine, of their lifestyle. Interstitial lung disease, the first part of the diagnosis becomes a thorough and detailed medical history. A detailed medical history with all the symptomatology that I've told you, as well as all the skin condition, joint condition that need to be asked very correctly and very in a detailed manner that needs to be asked. Another thing, the exposure history is also very important. So we need to like probe into the patient, ask him like detective questions, whether did you work there? Did you work in a factory where there was a lot of dust? Whether you used to live in an area where there was lots of pigeons. So all these histories build up the diagnosis. Then after the symptomatology, then we go on to the physical examination of the patient. So the patients often have cyanosis, that is, there is bluish discoloration of the lips, of the nail bed. Then the curvature of the nails also changes, leading to the picture called as what we call as clubbing. And later on we go on with the investigation part, the basic being the X-ray chest that shows the reticulations. The lines, reticulations are basically the lines that are seen traveling across the lung fields in the X-ray. And with the X-ray, there is spirometry that we also did for COPD, but in ILD, the pattern becomes restrictive. The patient is not able to breathe properly. The patient is not able to like blow out air for a longer time, longer duration. So we have got a typical restrictive curve that we see in the spirometry of the patient. But as ILD is like a very advanced disease, very complicated disease, so we need just by X-ray and spirometry, evaluation remains incomplete. So we need to go ahead with advanced methods, that is the diffusion testing. So diffusion testing is another advanced pulmonary function testing that can like capture, then can catch the ILD disease. Then we also go ahead with the 6-minute walk testing of the patient. We ask the patient to walk for 6 minutes at their comfortable speed. And by the end of the 6 minutes, we measure the saturation of the patient, we measure the distance that is traveled by the patient. So a fall of greater than 4% is taken as a significant desaturation in these patients. And a very important test that is required in these patients is the HRCT scan, that is the high resolution CT tomography. So we computerize tomography, so we need to go ahead with the CT scan of the patients, and in that HRCT cuts, we see those reticulations, fine reticulation, the ground glass haziness is seen, then honeycombing, different traction bronchiectasis. So there are variety of patterns that we see during the CT scan imaging reporting. And with all these things, we combine together and get to the diagnosis, that is ILD. There are two things happening in ILD. One is the inflammatory part and second is the scarring part. So let me tell you that the treatment options for ILD are not many, because the picture per se of this disease is very progressive and very gloomy. The patients keep on going forward, going ahead with the disease. But let me tell you another thing, that there is one part or few parts of this big spectrum of ILD that is composed of sarcoidosis and connective tissue diseases. These are some types of ILD that have got a good prognosis. And in these patients, the disease do not progress as much as you see in the other types of ILD. So in these patients, in these set of patients, there is a very good response and a very beautiful response with the corticosteroids. So corticosteroids basically it acts on the inflammatory part of the disease. So while we are like targeting the inflammation, and that is happening in like sarcoidosis, CTD ILDs, and some form of HP also, the response of the patients with anti-inflammatory agents. Then let us talk about those patients who have a progressive disease, that are not improving, that are either they are stagnant or their disease is either progressing. That means that the disease has come to the scarring phase. So when it comes to the scarring phase, then that is the time when we need to add antifibrotics to the patients. So there are mainly two antifibrotics that are there in the market. These two drugs have been shown to improve the quality of life of the patients a little bit, but much more they have been found to maintain or improve the lung functions of the patients. So depending on what the pathology, what type of the disease is, the treatment is advised to the patients, and as well as depending on whether the patient is in the inflammatory phase or whether the patient is in the fibrotic phase. So depending on that, we advise and prescribe the patient the required or necessary treatment. Because, as you know, the ILD, it is basically leading to the hardening of the lungs, because there is deposition of material in the interstitium. And so that leads to the hardening and stiffening of the lungs. So that stiffening, you can compare it with in our normal terminology, like the grape, the fruit grape. That is similar to our normal lungs. But when it becomes like kishmish raisins, then that is stiffened. And that is similar to our ILD, lungs that we see in ILD. So, I always tell my patients that can we, I ask them, can we like change raisins back to grapes? No, it is not possible. So that situation is similar to what is happening with the lungs of the ILD patients. The hardened, stiffened lungs are cannot be converted back into the normal fleshy lungs. That is being researched and studied all throughout the world. There's so many literature that is being published right now everywhere while we are talking also, that how to prevent such a deadly disease from happening. So one, it has been found that yes, definitely there are environmental allergens, antigens that are responsible for this deadly disease. One that I told, that is the pigeon droppings and feathers. So if you ask the patients and if you make them aware and vigilant about the deadly bad parts, ill effects of such pigeon exposure, then you can like prevent such disease from happening. You can educate the people. Then second, the factories, the stone crushing mill people. So they are like poor people who are working as a laborers in these factories. So they are like taking in so much of high intensity of stone dust, smoke inside their lungs, and that smoke or that stone dust get deposited in the lungs, causing this disease. Then we can like, the factory rules, regulations can be like modified in such a way so that we can like go ahead and we can prevent such a deadly disease from happening in these laborers and these people. And then awareness can be like in the form of the factory workers that are working, gemstone workers, when they work, like whether they are working for any ruby, emerald, any stone, they are like trying to like carve these stones in beautiful way. So that smoke that comes out during the process also leads to ILD. So we can like educate these people that all these can be harmful. But although these all environmental factors have been known, but it has been shown that not all people who are getting exposed to these antigens are suffering from ILD, are getting ILD. But it is, there is definitely a genetic predisposition. Some people who have genetic predisposition to develop ILD and who are coming in contact with the environmental antigens are the ones who are becoming patients of ILD. So a lot of research is being done to, decode the genetic predisposition and to find out who are the ones who can become ILD patients in the long run. The research is being done, studies are being, work is being done. So let us see what the future holds and what all new research is in the pipeline. I always advise patients of ILD, especially who are on treatment, anti-inflammatory treatment, because there are many patients are put on corticosteroids. So corticosteroids per se, they are associated with some side effects. So I always advise patients who are on corticosteroids to avoid big crowds, because they are immunosuppressed. So they can catch infections very quickly. One. Second, I advise them not to use sugar a lot in their diet. In fact, just stop taking sugar. Anything sweet is to be avoided. And third, I advise them to decrease their salt intake. Instead of putting salt, they can use lemon to add flavor to their food. Fourth, I advise them to take calcium daily. I prescribe calcium to them. So always take calcium. I always ask them to, whenever they go in sunlight, they need to protect their body with proper clothing to avoid phototoxicity. So depending on the medicine that is being prescribed to them, the various do's and don'ts are being advised to the patients.